This is the Children's Surgical Hospital in Entebbe, which was opened in 2021 to provide free pediatric surgical care in the country for children aged 28 days to 18 years old. On arrival, one is stunned with the beauty, tranquility and cleanness of the place with green landscape, which is important in the patient recovery and healing. The facility boasts 100,000 square feet of floor space, 72 beds, 6 for intensive care, 16 for sub-intensive care, and 50 beds in the ward. It also has 1 observation and stabilization ward, 6 outpatient clinics, diagnostic center, a laboratory for analysis, a blood bank, and a pharmacy, among others. The hospital was built to handle children's surgeries. Uganda faces considerable challenges in the provision of pediatric surgery and care for children and young people. The head nurse at the Children's Surgical Hospital, Giulia Pedroni, says they only deal with elective pediatric surgery.
Saying this is an elective surgical hospital, so our mandate is to perform elective surgeries for patients with some kind of diseases. I mean that what our main groups of disease are congenital and acquired defects of the gastrointestinal system, and we do a lot of urology and andrology and gynecologic operation. Then we do also functional plastic surgeries, so all of our surgery basically are aimed to correct conditions that are more or less severe, that were either there at the birth of the children or that were acquired for some reason, like post-traumatic or post-acute illness.
According to available statistics at the hospital, 14,470 patients have visited the hospital, with 2,125 surgical interventions done to date. Pedroni noted that emergency medical team conducts screening missions in different hospitals to identify children who require transfer from urgent pediatric surgery and follow-up care for patients that have been operated.
Thank God we can manage most of the cases, but also we did get some patients that we were afraid we could not handle. So unfortunately it happened that we got patients that already presented themselves at our outpatient department in an extremely bad condition. Few of them were already attempted to be operated in other hospitals, but without success because they were very complicated patients. Some of them were congenital. Few of them were acquired disease due either to trauma or to some acute illness that, I don't know, created intestinal perforation or intestinal fistulas. So unfortunately, yes, some of the patients arrived in extremely weak conditions. So for these patients, what we do is usually to have a period of hospitalization inside the intensive care unit, so that in intensive care we can really provide the maximum support for the patients, and then once the patients are a little bit more stable, they can be transferred here. And then when they are completely stable, usually the patients, they are transferred from here to the normal ward.
A special class was established for children to have class sessions. Here they reflect on their studies aimed at making the patients feel at home and safe.
We have in this hospital, it was put here just to make the children stay here as seamless as possible. You know, sometimes for the young children it can really be traumatizing to be in a hospital because we have some with conditions that may need them to be admitted here for more than a month or 2. So being contained in one place in bed can really be traumatizing to them. So they can come here, we do something in class, we also do play, like they have a normal life.
The facility generates its energy from the sun, equipped with over 2,500 solar panels, which provide part of the electricity needed by the building, reducing all the energy costs. Nutrition schedule for both patients and staff was also changed in line with their treatment. As head of logistics, Matteo Di Alonso explains.
For sure, the diets are different. So we have specific diet for patients, and more we have special diet for patients because maybe someone cannot eat protein, some other one cannot eat salt. So we have to follow all the nutritional indication that we have from the doctor. The canteen for the employees for sure is different because we are going to provide more calories.
Just like any other institution, Children's Surgical Hospital also face some challenges like lack of medical specialists, which are critical in ensuring high standards in pediatric surgery and reduction of child mortality in the country.
Challenges are usually due to the number of patients that we have. So our let's say, activities are increasing, and of course we struggle to keep the pace that we would like to keep. We don't want to let the patients wait too long, and as the population is knowing us more, we are getting more patients. So this is of course a first struggle that we are trying to face. And also the other struggle is the lack of some professionals. We also, our team is international, so we have expats from everywhere in the world, but the majority of the staff is all Ugandan. And even among the consultants from the specialized doctor, we try as much as possible to get doctors from Uganda. The challenge is that some of the specialized doctors that we need are not so much available. So there is a lack of some personnel that up to now we still have to cover with expats, such as anesthesiologists, such as radiologists, and also pediatrician. We struggle to get Ugandans. So
Zahara Abigaba, UBC News.